disorder. And moms and dads, if you suspect that a child that you love that you have is potentially going down the road of maybe having sensory issues, there are a number of different things that you want to understand about what sensory processing disorder is, but also how do you definitively get information to know if they truly are showing a sensory processing issue. So let's start talking about sensory in terms of bigger picture, right? Are a group of systems, right? It's the things that we see, smell, the things that we feel, it's the movements of our body, it's hearing, it's all of those things that integrate to give us the big picture of the sensory world of the environment around us. The proper integration of that sensory input is really critical to the function and development of our brain. And so when we think about sensory, right, we are used to the common senses, right? The sights, the sounds, the smells, all those things. But there's also other senses that many people are not aware of. There's things like our sense of balance and our sense of movement called proprioception. The proprioceptive input is different because most people are not aware that it's there, even though it's the sense that our brain is more dependent upon than all of the others. And the reason why this becomes very important is because in pediatric brain development, if a child is not getting proper proprioceptive input, it has a very specific long-term impact on the function and development of the brain. And so let me give you just kind of a basic framework to this. If you look at a child who has an underlying issue with sensory, there's also going to be developmental, potential social, emotional, and learning issues that can come with it because there is this movement sense proprioception that has the important role of organizing and calling the sensory input that comes into the brain. If we do not get proper proprioceptive input, then there is an alteration in the sensory world, whether it's our internal environment called interoception, which is our organs and our insides, or the proprioceptive environment, which is our movement. But also, if we have incorrect perception of the sensory world because of altered proprioception, it can mess with things like our ability to tolerate large volumes of sensory inputs, so going into sensory dense environments, our ability to keep our bodies calm so that we don't need to stim and move around a lot. It can affect and alter our sense of taste. So foods seem weird. It can affect things like our sense of smell. It can affect the way that we hear things. It can amplify and alter those. We've had children with sensory processing who things like the perception of a sensation on their skin, such as water, can feel like lukewarm water can feel like fire. And all of these things are alteration of the input coming into the brain. Many parents ask us, where does this come from? And, until I came into this realm as a parent, having helped my own child, I was wholly unaware of where this started. So I'm going to give you a framework to understand this. Sensory processing is something that is starting very, very early on from alterations in sensory input from proprioception that can start from things like birth trauma. So, the birth process, labor and delivery, because most people are not aware of the amount of force that is occurring during a standard labor and delivery process. You're talking that in a newborn baby, just a straight vaginal delivery, the amount of force with axial traction, what they call lateral side to side bending, and rotational forces on the baby's skull and neck can range from as low as 20 pounds of axial traction to in excess of 40 to 60 pounds of axial traction with lateral bending and rotation. When you get into more complicated, where there are interventions, where there's epidurals and Pitocin, those numbers go up exponentially. Those numbers can go up to starting points of as low as 40 to in excess of 80. Same thing with the cesarean section. C-sections are minimums of 40 pounds. And depending upon if they're using instruments such as forceps or vacuum, the poundage can increase to as much as greater than 100 pounds of axial traction on the neck and brainstem of a baby. So that will cause significant upper cervical trauma that does not require there to be fracturing or tearing, but not too dissimilarly to a person who is in a motor vehicle accident with a whiplash. The kind of trauma that's sustained there can be things where the brain goes into bracing so specific areas of the spine, and when the areas of the spine are no longer moving, they instantaneously and potentially on an ongoing basis will alter and distort proprioceptive input. And so there can also be things like positional issues in utero. So if you have a breech baby, a baby that is in an awkward position. So we have, oftentimes we'll get twins where one twin is in good position, the other twin is in a very bad position, and their spinal posture is contorted. And so they'll end up with all types of issues with, spinal contortions where the spine doesn't move the way that it's supposed to from the very beginning. And that can alter input, proprioceptive input to the brain. So there can be all of these different starting points. But what doesn't matter is how they got there, What matters is the effect that it's having on the brain because input ultimately determines output. If the input to the brain is altered, then what we're going to see on an ongoing basis distortions in output. And those output behaviors look like things like, can we stay calm? Can we sit still? Can we tolerate the textures of foods? Can we tolerate certain types of environments when we get sensory rich? Can we handle the feel of certain clothes on our skin? All kinds of things like that. So they can be many and varied in the impacts that they have on our kids. So what I want to do is I want to share with you just a simple example of how we test for sensory processing because when we see sensory processing, it's going to look differently than if you go into like an OT's office where they're going to do some of these, some different types of tests. We have tests that allow us to see what is coming into a child's brain and if the sensory input is coming in accurately or inaccurately. And this is a really amazing test because as we watch these things change, we also are able to go and track changes in the output, which is the subjective side of a child's behavior, the way they experience the sensory world, emotional regulation, sensory input, output, all kinds of different things. So let's start at the beginning. When there are these alterations in sensory input, they come from what is called a loss of kinetics or dyskinesia, loss of normal ability of a spinal vertebra to move the way that it's supposed to. So it cannot produce a neurotransmitter called GABA, which allows for all the sensory input to come in normally, keeping our parasympathetic nervous system and our frontal lobe and all of our sensory systems on normally. That alteration in movement called dyskinesia creates this thing called noxious stimuli the noxious stimuli results in altered sensory processing, increase in sympathetic output, which is fight or flight response, and it can lead to, in adult cases or in some cases, pain conditions. But that dyskinesia, that altered proprioceptive input, is going to be the trigger. And the more areas and more layers, and especially as you get closer to the brainstem, the bigger the alterations the sensory input become. And so I'm going to give you a case study here in a moment so we can talk through this, so we can look at some of these basics. But what ends up happening is that altered kinetics, it starts this cascade of events where there's this constant ongoing change in sensory perception that builds up in time until there's also alterations in things like energy expenditure. And so one of the scans I'm going to show you here is a scan called a surface EMG, where we're able to go and measure the output from these proprioceptor muscles to see if they are normal or abnormal. And then we look at things like the autonomic nervous system to see if there are alterations in the sympathetic and parasympathetic tone. And so let's take a look at a scan example here of one of our amazing little patients, this sweet little girl. Her name is Emily. And so Emily's case study is a wonderful one because when we look at Emily's case file, what it shows us is a stark contrast in the input-output relationship that we see here. And I'm going to pull this up here so you can see. So when we look at this graphic here, I think this will give you some understanding of what we're measuring. So what we're seeing here on this graph is the surface EMG scan. Now, the surface EMG scan you see here on the left, what it's doing is it's showing areas of energy output and imbalance. So an EMG literally is measuring input to a child's brain and central nervous system. So the way that this graph in particular is supposed to look is that it is supposed to be pear-shaped, where the top part of the scan is more tapered, smaller, and then it pairs out towards the center. And the entire graph is supposed to be at a much lower energy level because the colorations on here all mean something. The areas in white are considered to be within normal limits. The areas in green are 1 standard deviation above normal. The areas in blue are 2, and the areas in red are 3. So if you look at the left side scan, you see that there are big imbalances in energy input coming into Emily's brain. And so let me tell you how this is represented. So some of the challenges from top to bottom that Emily's been dealing with is she really struggles with focus and attention. Mom and dad say that she just can't sit and eat a meal. She struggles to follow through on things like puzzles. She'll lose focus on tasks like getting dressed. She struggles with multi-step directions. Her IEP goals are things like improving gross motor and fine motor, improving focus and attention up to 3 steps. She'll have meltdowns and big overreactions multiple times per day. They can last for 2 to 5 minutes. She'll have overreactions on things that are considered to be trivial. She has bowel issues, constipation, always very gassy, poor balance and coordination and proprioceptive awareness, terrible sleep, wakes up frequently, and a multitude of different things that are affecting her. Also, as a side effect, there's also some issues with bedwetting. So scan 1 is our starting point. So that would be the one done in October. Now, as we adjust her, we alter the input. We start changing the kinetics of the spine You change the kinetics of the spine. Then what ends up happening is that the spine begins to move, the proprioceptive input begins to change, and then the brain begins to get new energy balances, new energy patterns. And what the brain does downward is it starts to reorganize. And so if you look at pattern 2 on the right side, that pattern is a far more efficient, more normal scan pattern. The energy levels are still a little high, but it's far more organized, far more balanced, far closer to what we want to see coming in. What'll happen with this as we continue to adjust over the next few months is the energy will continue to calm down. Her energy levels outwardly that mom and dad see will continue to calm down. And she's already made some great changes. But we're going to see continued improvements over the next several months as her nervous system gets more and more and more of the correct proprioceptive input for the first time in her life. But what you see from left to right is just a month. You can look at the dates 10/17 to 11/14 of 2022. That is a large degree of improvement in just a 1 month's time on the input. And mom and dad are already starting to see some of those improvements. So, as of her most recent progress exam, when she started, she was having meltdowns 2 to 3 times per day. Mom and dad said that at most right now, she's having them no more than 1 time per day, and she is redirected far faster. She's showing improvements in bowel movements. She's making a bowel movement 1 time per day every day. Her PTs and her OTs show that she is 75% of the way to some of her PT and OT goals, which is a huge level of improvement. Her sleep quality is improved. She will wake up multiple times per night, and it would take her quite some time to go back to sleep. And her mom and dad said that right now, she may get up in the morning, but if she does, she'll go right back to sleep when she goes into bed with mom and dad. And she's also no longer having any bedwetting accidents. That's a month's time. This is still really early. What mom and dad are seeing and what this case study exhibits is reorganization of the brain through the process of neuroplasticity. The brain's ability to change, to refire, and rewire is always there. But what you have to do is you have to clear out the interference that was there and all the alterations in the sensory environment that Emily's brain was getting. And in doing so, what this allows us to do is to be able to change the input. And as the input changes, her brain refires and rewires, and it starts to correct then the sensory world because she now starts to perceive the environment correctly. We start seeing better and better ability to control things like her energy levels and her temperament because her brain now, for the first time in her life, is getting the right messages in. And then her autonomic nervous system calms down and her balance and coordination progressively get better and her ability to self-regulate get better and better. And this whole process is going to be progressive because her nervous system is going to continue to refire and rewire. And as we get further and further along, we're going to see bigger and bigger and bigger leaps. In a month, what we just talked about is a huge level of improvement. But 3, 4 months down the road, this will look like nothing compared to where we'll be because her nervous system will have had so much more time to get the right messages in. So, guys, I hope this was helpful. If you have a child with sensory issues, this is the best sensory test I've ever seen because you can see what's coming in, but more importantly, you can see it corrected and then say the direct output, not only on the scans, but on the way that your child is living within the sensory world. You can see all of those improvements in quality of life measures because ultimately, the testing helps us to get to changing the quality of life, and that's what matters most. God bless you guys. See you in the next one.